of the sheaths develop into lesions that begin to scatter. The myelin becomes spongy and no longer the formed sheath that it should be, coalescing into a combined degeneration, impairing nerve conduction. If the nerves can't properly conduct a signal, minimal communication happens. Without a signal, the brain can't interpret sensory information. And if parts of his optic nerve become damaged because vitamin B12 wasn't present for methylmalonyl-CoA mutase to convert propional-CoA to succinyl-CoA so that the Krebs cycle in the cell can properly produce the ATP and fatty acids needed for its synthesis of its myelin sheath, then this could explain why DA has become legally blind from his strict diet of French fries and potato chips, because these are the foods that are devoid of vitamin B12. This didn't have to happen. Optic neuropathy has a long list of causes. Nutrition is not typically the first thing that anyone medically trained in America, Europe, and Australia think of, because malnutrition, especially in the context of vitamin B12, is not common. DA's body weight was well within average for his height. He didn't look malnourished from the outside, but if doctors just thought of nutritional optic neuropathy right from the start and simply just stopped and didn't look into the other causes of his blindness, in this case, they would have been correct. But what if it wasn't nutritional in origin? What if they missed a more common and life-threatening cause of his blindness and let that disease progress? You can't just stop at a nutritional cause in this case without ruling out the other possible etiologies. There's a lot of CYA in medicine, and this is a very clear example of it. Do you remember the name of the stomach protein, intrinsic factor? Well, humans didn't know what the extrinsic factor that binds to it to alleviate the pernicious anemia that these patients were getting. In the late 1800s, doctors started feeding patients with this deficiency raw animal liver with some success. This was the dietary extrinsic factor at play because liver, we know now, has a lot of vitamin B12. A Nobel Prize was won in 1934 for those experiments. Decades later, humans used X-ray crystallography to see what extrinsic factor, or what we know now as vitamin B12, looks like. And Professor Dorothy Hodgkin was the winner of the Nobel Prize for doing exactly that, paving the way for it to be synthesized in the lab, to be added to foods, to make supplements out of it and injection formulations of it if their stomach won't allow them to absorb it, to have it so that most people just can't miss it, because we know without it, this deficiency will cause anemia and neurodegeneration ranging from a simple mood impairment to blindness and dementia. But some people will always slip through the cracks. The people most susceptible to B12 deficiency today are those who follow an abnormally strict vegetarian or vegan diet, who wrongly refuse supplementation, who don't eat cereals, which in the United States are almost all fortified with vitamin B12. For DA, vitamin B12 injections were restarted. He was counseled for his eating habits. Problems coming from B12 deficiency. A grandma ate cookie dough every week for lunch. This is what happened to her bones. CC is a 78-year-old woman presenting to the emergency room with night sweats, hot flashes, and insomnia. She tells the admitting nurse that she had unintentionally lost at least 25 pounds over the last 2 months. CC was a grandma originally from South America. She came to the United States with her son in the 1980s. Every week, CC would bake cookies for her grandkids. This was their favorite part of the week. Grandma knew exactly the kinds of cookies that they loved to eat, and she never forgot to make extras for them to bring back home. While baking, CC would always eat some of the cookie dough. There was always more than enough for everyone, and she thought to take the opportunity to have some herself. About 4 months ago, she started having trouble sleeping. She was getting night sweats and hot flashes. Every day, she'd notice her weight decrease on the scale. She wasn't eating less, she wasn't exercising more. She wasn't sure how this was happening, but she didn't think too much of it. Skin deep, CC was relatively healthy for a 78-year-old. She had type 2 diabetes, but she took her medicines every day for it. She had high blood pressure and a heart condition known as atrial fibrillation, where one part of the heart beats so quickly it doesn't actually produce a good contraction, which allows blood to pool, which could form a clot and get lodged in her brain and cause a stroke. But this was well controlled with medicines too. And just having these 3 problems at 78 years old isn't bad. But unintentionally losing 25 pounds in 2 months is probably something very bad. The weight loss isn't associated with diabetes because, well, she's eating sugary cookie dough at least once a week, and that's not exactly something that's going to help you lose weight. CC asked the admitting nurse if the hot flashes were some sort of low-key fever. She was aware of the risks of eating cookie dough because raw eggs have the bacteria Salmonella. So she wanted to make sure that she wasn't getting some kind of infection. But without presenting with nausea, vomiting, diarrhea, or an actual fever, it doesn't seem like she has any kind of food poisoning. Because she's 78, she's well past menopause, meaning that her night sweats are probably not hormonal. Not much has changed in her lifestyle, so it's likely that the sudden weight loss, given her age, could be cancer. Analysis of CC's blood finds anemia, an meaning without, and emia meaning presence of blood. The size of her red blood cells are normal, but the problem is that she just doesn't have a lot of them floating around in her body. 2 months earlier, CC had come in for her regular checkup. Blood was drawn then too, giving us a baseline measurement. She had this anemia back then, but it's much worse now. Nitrogen and a waste product called creatinine are present at a level 3 times higher now than compared to 2 months ago. The kidneys are supposed to be filtering these things out of the blood, but now they're not. Her kidneys are failing. A massive amount of protein in her urine, more than 40 times the upper limit of normal, is collected. Cookie dough has raw eggs. Eggs have a lot of protein, but this isn't the protein that's in CC's urine. Eggs don't cause kidney failure. Cookie dough can cause food poisoning, but food poisoning isn't kidney dysfunction. But diabetes causes kidney damage. Elevated blood sugar levels and increased inflammation contribute to kidney injury. But if we have a baseline measurement from 2 months ago, this rate of decline is just way too quick to count it as diabetic nephropathy, meaning that something else must be causing this problem, which brings us back to cancer. CT scans of her chest, abdomen, and pelvis reveal nothing. Her lymph nodes, which are typically the first sites to where cancer spreads, were clear. No primary tumor or metastatic disease to be found, so it doesn't look like she has a solid organ cancer. But how about bone marrow cancer? That would cause problems with her blood cells, and she does have anemia. Except analysis of her blood proteins again reveals no cancer. But the results are borderline and non-specific. Clearly, something is wrong. They show maybe an infection of some sort, which might point us back to the cookie dough that she eats for lunch every week. But time is up. She doesn't have a life-threatening emergency. Without a good reason to admit her into the hospital, CC is discharged from the emergency room and she's referred to the kidney clinic. They sample some kidney tissue from her to look at underneath a microscope. As the days go by, CC's night sweats become more intense. She continues to bake the cookies for her grandkids because she doesn't want to stress them out. She doesn't want them to even think that anything is wrong. This health scare shakes her confidence, but she doesn't have cancer, so it's probably not that serious, she thought. In the kidney clinic, 2 weeks later, it's revealed that CC has deposits of antibodies and complexes in the capsules of her kidneys. These regions of dense buildup tell a story that something has been happening with her immune system for some time now. Antibodies that would have been used to combat infections have infiltrated her kidneys. This accumulation means that maybe she's had a chronic or long-term infection that's been ongoing. Or that maybe she has autoimmune disease, meaning that her immune system has been wrongly activated to attack her own body's cells. If she's eaten cookie dough every week for a long time and salmonella from the uncooked eggs are in there, then maybe that could be her chronic infection? But that doesn't make sense, since that would mean that the bacteria would have spilled into her blood at some point in time, and that bacteremia, or bacterial presence in blood, would have been obvious. And without a history of lupus or arthritis or anything like that, it doesn't look like she has autoimmune disease, but we can't know for sure. But what we can know for sure is that CC's kidney function has worsened again. Over the next 24 hours, more than 10 grams of protein are collected from her urine, indicating severe kidney injury. Whatever the case is, it looks like her immune system is more active than it should be. The best way to resolve this inflammation is to give her corticosteroids, which are medicines that reduce the activity of the immune system. She started on a high daily dose of prednisone and sent home. But things only got worse. It's a week later. CC presents again to the emergency room, this time with fevers, chills, and hematuria. There is now a presence of blood in her urine. She's nauseous, vomiting, and has severe diarrhea. Salmonella enteritidis, the bacteria commonly found in uncooked eggs from cookie dough, was isolated from her urine and her blood cultures, as well as her stool, confirming this time an acute infection. High-dose corticosteroids immediately increases the risk of infection because of its action on the immune system. Her steroid dose is tapered, and she's started on antibiotics, and her fever quickly resolves. Her urine and blood cultures become sterile as her infection is then rapidly cleared. As she's discharged from the hospital, she's told to stop eating cookie dough. She's told to stop eating anything uncooked. She's given a 4-week prescription for antibiotics to make absolutely sure that the infection is cleared. Explicit instructions were given to her to complete the entire course, even if she feels okay. And she feels great, until 2 weeks pass. Cece can't stand on her own because of a sharp pain in her right leg. She starts scratching her back and it becomes painful as she realizes a giant rash has developed as her fever, nausea, and vomiting return. Back in the emergency room, again. The medical team looks at the rash closely. Plaques and scales were observed. Usually rashes come from an allergy. Because she's on new antibiotics, this might be an allergic reaction to them. But an antibiotic rash doesn't look like plaques and scales, meaning that this is probably something else, which is confirmed because Cece tells the medical team she never filled her prescription of antibiotics because she felt like she didn't need them. As Cece is triaged in the emergency room, she needs to use the bathroom. Despite the searing, stabbing pain in her right leg, she didn't tell the medical team about it. She was too preoccupied with scratching her back for them to notice. As she gets up, she feels her right leg pulse. She hears a fibrous snap as she suddenly collapses to the ground. The medical team suddenly rushes to her. Imaging finds multiple lesions in her fractured right tibia. Cece didn't tell the medical team that several years ago she had broken her leg at this exact spot. Bone biopsy finds Salmonella enteritidis as the causative agent of this osteomyelitis. Osteo meaning bone, myelo referring to marrow, and itis meaning inflammation, or in this case, infection. A bone infection that was found again with a blood culture confirming Salmonella bacteremia, meaning that within the time span of just a couple of weeks, the same exact bacteria from the eggs in her cookie dough is again infecting CC. The mysterious kidney failure, the severe infection after steroids, the rash, the recurring infection. The medical team realizes that this is a case of immunocompromise. There's only a couple situations where recurrent Salmonella enteritidis bacteremia could happen. The first is an organ transplant where medicines would have been given to suppress the immune activity to prevent the body from rejecting the donated organ. But CC never had an organ transplant, meaning that this could be a case of acquired immunodeficiency syndrome, also known as AIDS. At this realization, the medical team immediately tests her for human immunodeficiency virus. Serologic testing returned positive. A viral load of 550,000 copies per milliliter of blood was found, and a measure of her CD4 T cells, which are the immune cells that are targeted by the virus, was 60 cells per milliliter of blood. Under 200 cells per milliliter is the criteria for AIDS, as she's diagnosed with it for the first time at the age of 78. This finding is consistent with everything. HIV is known to cause kidney damage in late-stage disease. This nephropathy is characterized by gross proteinuria with rapidly progressive kidney disease. The collapsing form of focal segmental glomerular sclerosis with interstitial inflammation is a classic presentation of HIV-associated nephropathy, but only obvious in retrospect. Rashes are common in HIV patients, and this rash was not characteristic of an antibiotic hypersensitivity. Very high-dose prednisone, like the one CC received, is not something that you want to give to an AIDS patient because the medicine increases the infection risk of a patient.